Good afternoon. Summer officially begins this Friday, and for many families, camping is on the to-do list. Joining us with some summer safety tips is Dr. Nathan Graber. He is a pediatrician at St. Peter's Pediatrics in Clifton Park. Good afternoon, Dr. Graber.
Good afternoon, Courtney.
And so when planning your family camping trip, what are some of the first things that you should check off on your to-do list?
Well, first of all, you should have a to-do list. That's really important, and being prepared is incredibly important when you're going camping. I want to start by just saying that there are a lot of good checklists for packing that are out there. The one that I prefer, I downloaded off the New York State DEC website. And this one, it has a complete list of all the things you're going to need while you're camping. The one thing it's kind of missing here is on the very first thing should be a big smile. Why? Because you made an excellent choice for a family vacation. There's really nothing better than camping. Not only is it a great way to build memories with you and your family and your kids, but it's also a great way to get kids out in nature, which is essential for healthy physical development and mental health. So a couple of things I just want to talk about while you're preparing to get ready for your camping trip. I'm also getting ready for a camping trip right now with my kids. We're going away in a couple of weeks. And there are a few things you need to do. Number one, make it a family activity, the preparation. So you have your checklist, you get all your items together. Some of the things that you should be doing is thinking about some of the activities you're going to participate in while you're there. Campsites, there are campsites all over, and you can get them anywhere. And one thing to do is to sort of have a map. I downloaded a map from a campsite from the DEC website as well, and you can download those maps beforehand, and they'll have a list of activities that you can partake in while you're at the campsite. Almost every campsite, of course, you're going to have cooking, and you're going to have bonfires, and you're going to have swimming and fishing and hiking and lots of other outdoor activities and biking. When you do that, there are some activities that your kids may not be familiar with. So for instance, spending time out in nature, some of your kids are afraid of bugs or afraid of animals. It's very easy to overcome those fears. Those fears are natural for kids who've never been around bugs and animals. So the easiest thing to do is to just head over to the library, pick out some books on insects, and read them with your kids and explore and set a checklist for the types of bugs you want to find while you're out there camping and make it an adventure. I mean, collecting fireflies is always a fun camping activity, and it's something that will help your kids be much more comfortable with bugs. Other things you should do is sort of make sure that you have adequate supplies with you of safety equipment. Okay, things that you'll need for the kids while you're there. Just skipping ahead a little bit, sorry. I know you're gonna. I just want to talk about a few things that are very particular as a pediatrician that I want you to be aware of. Number one, some of your kids have chronic medical conditions they'll need treatment for, things like asthma or allergies, or they'll take medication for other conditions. Make sure that those medications, that you have an adequate supply to bring with you, and that take a look at the medications themselves, make sure they're not expired. Give your pediatrician at least a week in advance to try to get those prescriptions refilled before your trip, just so that you make sure that you have it and you have it with you. Some medications you need to keep them refrigerated, and for those medications it's a good idea to call the manufacturer before you just stick them in the cooler with some ice to make sure that that's a good way to keep them safe while you're camping. Other things that you're going to need while you're camping are things to protect you against insects. There are mosquitoes and ticks and black flies and other things that are going to try to eat to suck your children's blood. So with those in mind, it's a good idea to make sure that everybody has loose-fitting, long-sleeve and clothing, and long pants, socks, things to protect their skin from direct contact. But there will be exposed skin, and there will be ways that insects will get into to find your kid's skin. So you're probably going to need some insect repellent. Choosing an insect repellent, there are some great resources out there. First of all, there's a website called healthychildren.org. Okay, and on their website, they do have fact sheets for parents, like a parent's guide to insect repellents. You can also get those from the New York State Department of Health, like Fight the Bite. It's a nice brochure. And essentially what it says is that you should use an insect repellent that has an active ingredient which has been proven to work. So one of the active ingredients, and probably the most common one you'll see if you head over to the pharmacy, is something called DEET, D-E-E-T. And you should use an insect repellent that has a concentration of DEET that's somewhere between 10% and 30%. Nothing more than 30% has been proven to be any more effective than 30% DEET. The higher the concentration, the longer it lasts. And try not to use it over a child's entire body. You want to use it just on their exposed skin, and only for children 6 months of age and older. In most cases, you can spray a little bit on their clothing and never ever spray it on their face. Just use a little bit on your fingers and rub it into their skin. The other thing that you should be thinking about, because when you go camping, you're going to be outdoors all day long, is protecting your kids from the sun. Sunburn isn't just uncomfortable, but it actually increases the risk for skin cancer later on in life. So you want to make sure that when they're out, that once again, light colored, loose fitting clothing that covers most of their skin. Wear a hat when they're out camping and hiking and swimming. That's gonna help, but of course there's going to be exposed skin. So you should pick up a sunscreen. Okay, and sunscreens, it's recommended that you get a sunscreen that's at least SPF 15 or greater. Most sunscreens for children are SPF 30 or better. Like I have a couple of examples right here. And these are waterproof, but they also say something else on them, that they're broad spectrum. And you should always pick one that's broad spectrum. It's going to protect against UVA and UVB radiation that comes from the sun. And in both cases, it'll protect them from sunburn. You should have a first aid kit with you. In your first aid kit, remember to pack things like Band-Aids, antibiotic ointment, something to clean the skin. You should have some hand sanitizer at the campsite anyway, just to make sure that kids keep their hands clean before they eat. And you should also think about things like over-the-counter medications. The only ones that I recommend are things like acetaminophen and ibuprofen. Those are for pain or for fever. And then diphenhydramine is an antihistamine, which is really good for allergic reactions. And check with your pediatrician to make sure you know what the correct dose is for your child. Don't always rely on the package inserts, which are sometimes based on age, not necessarily weight. The other thing I just want to say is that when you're traveling with kids in the car, there's always a possibility of car sickness. The first thing I say as a parent is make sure you have the baby wipes very handy, because you're going to need them. Not just for accidents in the car, but also for cleaning up kids when they get dirty while they're driving in the car. But car sickness, motion sickness, you can think of ways to prevent it. The first thing is, if you have a child who's prone to car sickness, you should really talk to your pediatrician. Some things, or natural remedies, tend to be effective. Things like ginger ale, ginger chews, which is a candy made from ginger, have been shown to be somewhat effective. There are medications that are sold over the counter that are antihistamines. You might have heard of things like Dramamine that may also be effective. Check with your pediatrician before you use them to make sure it's safe for your child. I think that covers most of the safety.
What about, and of course, when we think of summer, you can't think of summer without swimming. Any summer swimming safety tips that you want to share with families?
Oh yes. Well, the first thing is that the water, drowning is one of the major causes of fatalities in kids, and we have to do everything we can to try to prevent kids from putting themselves at risk. The first thing I always say is teach your kids how to swim. It's really important that every kid learns how to swim. So there are lots of available swim lessons. You should go call your local community center, the YMCA, local pools, and rec centers. And the next thing is always swim in an area or at a beach that has a lifeguard present. So at a pool, at a beach, with a lifeguard present. Even if there's a lifeguard present when you're swimming with young kids, it's a really good idea to keep them at arm's length and always have an adult who's there watching over them. If you choose to swim in a non-lifeguarded area, there has to be a responsible adult who knows how to swim, who's a good swimmer, who's prepared to be in the water with the kids. and we'll always keep them at arm's length, and be very careful about where you choose to swim, because you don't want kids swimming where there's fast currents or nearby waterfalls or other hazards that can increase their risk of drowning. But so I'm not trying to discourage anyone from swimming. I want everybody to swim safely. I love swimming. My kids love swimming. So the other thing is boating. We're all going to spend a little bit of time on our canoes and kayaks and stand-up paddle boards and whatever else you like to spend time in. And everybody, including adults, needs to wear a properly fitting personal flotation device at all times while you're on the water. It's really important for the young kids that the flotation device not only fits correctly, but also should have a strap that goes between their legs. This way they don't slip through and lose their personal flotation device if they should fall into the water. Other safety things, and this is really important, is that if you're supervising children or you're spending time in or on the water, it's really important not to consume any alcohol and stay away from alcohol. So I guess that kind of sums it up. I think camping is an excellent activity. It's a great way to spend time with your kids. It's a fun family vacation. If you prepare for not just the good weather, but for the bad weather as well. I once had a ski instructor who said to me, there's no such thing as bad weather, only unprepared people. So make sure that you bring lots of board games and books and things to do in the tent on a rainy day. And also, before you leave, make a list of the local attractions and activities, things like historic sites, museums, ranger stations where they may have activities for kids for rainy days. Also, the other thing is when you're preparing for your trip, the Parks Department and National Parks, they'll have junior ranger programs and similar activities that kids can engage in, which will help them help you and them explore the area more thoroughly and increase the amount of activities that you can engage in while you're camping. It's a really, really fun activity. You want to be safe, and once again, I'm just going to point out there are a lot of great resources on healthychildren.org, which is the American Academy of Pediatrics website. It includes tips for insect repellent, safety and sunburns, hiking, and then there are water safety tips as well. So make sure that you check out those fact sheets.
Great. Dr. Nathan Graber, thank you so much for taking the time today to talk about this. We appreciate it.